Have you ever wondered why hypertension, also known as high blood pressure, is often referred to as a silent killer? It's a question that can provoke a lot of thought. Hypertension, in simple terms, is a health condition where the force of the blood against your artery walls is consistently too high. Imagine a garden hose with too much water pressure. The excessive force can cause damage over time, right? The same principle applies to our arteries. This persistent high pressure can lead to serious health problems, heart disease being one of the most severe. What makes hypertension particularly dangerous is its lack of noticeable symptoms in the early stages. It quietly damages your arteries, your heart, and other organs, while you remain oblivious to its effects. Just like that, it earns its moniker, the silent killer. Understanding hypertension is the first step in managing this silent threat. So, let's venture further into this topic and unravel its complexities together. Did you know that there are two main types of hypertension? That's right. The first type is primary, or essential hypertension, and the second is secondary hypertension. Primary hypertension is the more common of the two. It's a bit like a slow-moving river, developing gradually over many years. It's a sneaky one, often creeping up without any clear cause. Scientists believe that it's a combination of genetics and environmental factors, like a high-salt diet or lack of exercise, that sets the stage for this type of hypertension. On the other hand, secondary hypertension is a quicker mover. It pops up suddenly as a result of an underlying condition. It's like a flash flood following a heavy rainstorm. Conditions such as kidney disease, hormonal disorders, or even certain medications can trigger this type of hypertension. It tends to cause higher blood pressure levels than primary hypertension, and it requires a different approach to treatment, often focusing on resolving the underlying condition. You may be wondering, why does it matter which type of hypertension you have? Well, each type of hypertension has its own set of causes and factors, and therefore requires a different treatment strategy. Understanding your type can help tailor your treatment to be more effective, reducing risks, and improving your overall health. Knowing the type of hypertension you have can guide your treatment strategy. So, it's essential to keep regular checkups with your healthcare provider to monitor your blood pressure levels and stay ahead of the game. What causes hypertension, you might ask? Well, the answer is multifaceted. Hypertension or high blood pressure can be sparked by a variety of factors, some within our control, others not so much. There are two main types of hypertension: primary and secondary. Primary hypertension, also known as essential hypertension, doesn't have a clear, identifiable cause. It tends to develop gradually over time, often as a result of a combination of factors. These can include age, as the risk of hypertension increases as we get older, and genetics, as those with a family history of the condition are more likely to develop it themselves. On the other hand, secondary hypertension arises as a result of an underlying health condition. These can range from kidney disease to hormonal disorders, and even certain medications. It's a bit more insidious because it often appears suddenly and causes higher blood pressure than primary. Now, let's delve into lifestyle factors that can contribute to both types. An unhealthy diet, particularly one high in sodium and low in potassium, can lead to increased blood pressure. Sodium makes your body hold on to water, which increases the volume of blood and, subsequently, the pressure. Conversely, potassium helps balance the amount of sodium in your cells. If you don't get enough, you may end up with too much sodium in your blood. Physical inactivity is another culprit. Regular exercise helps keep the heart and blood vessels in good condition, reducing the risk of hypertension. But without it, you might find your blood pressure creeping up. And then there's alcohol and tobacco. Excessive drinking and smoking can dramatically increase your blood pressure, while also damaging your heart. Alcohol can temporarily raise your blood pressure, and too much over time can lead to chronic hypertension. Tobacco, on the other hand, contains chemicals that can narrow your arteries, causing your blood pressure to spike. While some causes are out of our control, many are lifestyle choices that we can change. So remember, understanding the causes of hypertension is the first step towards managing and potentially preventing this condition. Are you aware of what increases your risk of developing hypertension? Let's delve into the various factors that could put you on the path towards this health concern. First off, age is a significant player here. As we grow older, the risk of hypertension increases. This is because, with age, our blood vessels lose some of their elastic quality, which can contribute to increased blood pressure. Race can also be a factor. Research indicates that hypertension is particularly prevalent among African and Afro-Caribbean communities. However, it's important to note that anyone, regardless of their race, can develop hypertension. Family history is another key factor. If your parents or close blood relatives have had hypertension, you're more likely to develop it. Being overweight or obese is a substantial risk factor. The more you weigh, the more blood you need to supply oxygen and nutrients to your tissues. As the volume of blood circulated through your blood vessels increases, so does the pressure on your artery walls. Similarly, a lack of physical activity can increase your risk of hypertension. Regular exercise helps keep your heart and blood vessels in good condition, reducing your risk of hypertension. Use of tobacco, be it smoking or chewing, can damage your blood vessel walls, narrowing them and increasing your blood pressure. Next up, diet plays a crucial role. Too much salt or sodium in your diet can cause your body to retain fluid, leading to hypertension. On the flip side, a diet too low in potassium can let sodium in your cells build up, which increases blood pressure. Excessive alcohol consumption can, over time, damage your heart. Drinking more than moderate amounts of alcohol can raise blood pressure and also potentially reduce the effectiveness of certain blood pressure medications. Finally, chronic stress can lead to bad habits such as eating unhealthy food, drinking alcohol, or smoking, which can, in turn, raise your blood pressure. Identifying your risk factors is crucial in managing and preventing hypertension. So it's worth taking a moment to reflect on your lifestyle and see what changes you could make to lower your risk. Now that we know the risks, how can we prevent hypertension or manage it if we already have it? Preventing hypertension or managing it effectively involves a series of lifestyle changes that are not only beneficial for your blood pressure, but also for your overall health. Let's delve into these preventative measures and precautions. Firstly, maintaining a healthy weight can significantly reduce the risk of hypertension. As your weight increases, so does your blood pressure. Strive for a balanced weight, and remember, even losing a small amount of weight if you're overweight can have a significant impact. Secondly, regular exercise can't be overstated. A good 30 minutes of moderate exercise a day, like brisk walking or cycling, can help lower your blood pressure and keep it down. If you're not into exercising, don't fret. Start slow and gradually increase the duration and intensity of your workouts. Now, on to the diet. A balanced diet rich in fruits, vegetables, whole grains, and lean proteins is crucial. Also, reducing your sodium intake can help manage your blood pressure. Try to limit your salt intake and avoid processed foods that often contain high levels of sodium. Alcohol. While moderate drinking may not harm your health, excessive alcohol intake can contribute to hypertension. It's best to limit your intake to moderate levels. That's typically up to 1 drink a day for women and up to 2 drinks for men. Smoking is another risk factor for hypertension. Each puff of nicotine you inhale causes a temporary increase in blood pressure. Quitting smoking helps your blood pressure return to normal. Lastly, stress management is key. Chronic stress can lead to hypertension. Find healthy coping mechanisms like yoga, meditation, or simply taking time out for hobbies and relaxation. Prevention is always better than cure. Adopt these lifestyle changes and keep hypertension at bay. Your health is worth the effort, and every small step can make a big difference. Remember, your body is your temple. Treat it with respect and care. To sum it up, hypertension is a silent killer that creeps in without any obvious symptoms. Over the course of this video, we've discovered that hypertension, commonly known as high blood pressure, is not something to be taken lightly. It can be categorized into 2 types, primary and secondary, with the former being the most common and the latter usually being a symptom of another health condition. We've also learned that the causes of hypertension are numerous, ranging from genetic factors to lifestyle choices, such as diet and lack of physical activity. Similarly, the risk factors are equally varied, including age, family history, obesity, and stress levels, among others. But it's not all doom and gloom. there's a silver lining to this cloud. Hypertension is preventable and even manageable, with the right precautions in place. Regular checkups are crucial to monitor your blood pressure and catch any potential issues early. In addition, making positive lifestyle changes, such as adopting a balanced diet, getting regular exercise, limiting alcohol and tobacco use, and managing stress, can significantly reduce your risk. Understanding your personal risk factors is also key. By knowing what makes you susceptible, you can take proactive steps to maintain a healthy blood pressure level and keep hypertension at bay. So remember, knowledge is power. The more you know, the better you can protect yourself from this silent killer. Stay informed, stay healthy, and keep your blood pressure in check. Your heart will thank you.